Welcome everyone to the October session of Qliq University. Today's session covers healthcare chatbots and kind of a little peek into the future of QliqSOFT and what we're doing in that market. I am Jolean Sheffield. As always, I will be your instructor today, and I am also the Director of Customer Success with laterals into our chatbot market. So today we're going to be covering what are chatbots for healthcare, patient engagement done right where the patient is, and we'll cover that optional homework that we look at each and every session. Just a reminder, all lines are muted to prevent any kind of audio interference that can occur, and we will go ahead and jump into the session at this point. It is going to stay to our 30-minute timeline in respect of everyone's time, and the session will be visible online at QliqSOFT.com/QliqU, and you'll be able to view that recording within probably about 72 hours of today's session. All right, so first of all, what are chatbots? Many of you probably already have experience with chatbots, so this question may have already been answered in your mind, but simply put, a chatbot is a computer program designed to simulate conversations with humans. Now, whether that simulation is occurring in the retail space, the customer service space, finance, travel, entertainment, healthcare, all of those different markets, if it is an automated conversation with a computer, AI, or natural language processing software between them and an actual human, then it meets the definition of a chatbot. So you can see on my screen here, I have mentioned those different fields there, retail, finance, etc. Your bank, for example, might have a chatbot when you go to contact customer support, or maybe you let them know you're traveling so they can put a note in your cards, don't get flagged for fraud use, things like that. A lot of those financial corporations are handling that in an automated fashion now using chatbots. Retail, again, I'm going to give a specific example here in a moment, but many of you have probably encountered that when you go on those retail sites and you're doing your shopping, many times when you click on Contact Us or Contact Now, that is being handled by a chatbot. Now, unfortunately, sometimes that experience is not what you dreamed it to be, right? I can think of a time when I interacted with my cable provider and I asked a very straightforward, simple question, confused the bot. It had no idea what I was trying to ask, and I got some gibberish back from it that it was completely nonsensical, and it made me realize I'm actually talking to a computer and not a live person. So as we start to look at chatbots for healthcare, that is something that is a risk, an experience, a poor experience that we want to mitigate, and we mitigate that through the use of artificial intelligence, natural language processing, and conversational AI. So AI that really has a personality, uses things like emojis and reactions that make sense to actual humans. So whether you are booking a reservation through OpenTable or some other source, you are probably already interacting with a chatbot today. You can see this slide's a bit busy here, but I had a lot of information I wanted to squeeze in. If I can draw your attention to the middle of the slide and how I have healthcare highlighted here, these are industries of sites, so websites that have chatbots embedded in them in some form or fashion. Now, so far, we have only talked about chatbots on websites, but we're going to get to some of the other deployment methods shortly in this presentation. But looking at industries of sites with chatbots and those specific industries, you can see internet software is leading the pack there. There's also some that can't be categorized, so they're in other category. Professional services are high utilizers. And surprisingly, what some of you may not have anticipated is healthcare is also up there in the top 10. So some people say, you know, chatbots are fine. I just really don't see the application for healthcare or reaching my patients. But as you can see from the statistics in the top right corner, we know that fewer than 2% of patients will ever access a patient portal, and even fewer of those will access it a subsequent time and use it to manage their care in a meaningful way. Now, maybe at your organization, that's not your experience and y'all are having a great amount of effort and results around your patient portal, and that is fantastic. But for the majority of organizations, of healthcare entities, really struggle with that patient portal access. One reason may be that patient portals were really designed to meet meaningful use, and not necessarily to be used meaningfully. So that could be some of the hindrance. The other hindrance is also just setup, registration, access to that portal. So anytime a patient has to access a portal with a login, or they have to download an application, for example, those things are barriers to adoption. So with that said, we also know that 75% of readmissions could be prevented with better care coordination, and that patients are expecting a consumer experience, and the difference in your survey results there from moderate to excellent can be a difference of 60% in your financial performance. So we know that that has a huge impact, and many of our customers that we've talked with about chatbots have had a little bit of reluctance that maybe they deal with an older population or a population that isn't as tech savvy, and their fear is that those individuals will not want to adopt chatbot technology. And surveys are actually showing the opposite. I recently sat in on a presentation from a large health system, I'll just say Methodist Health System, and they did a very good detailed survey of their patient population across all age spectrums. And what was most revealing was that from pediatrics to over 80, everyone ranked their desire to interact with chatbots the same. So it actually did not have that age variability that we might expect. Another example up in the top left corner here, Survival Life. It's just a website, a retail shop that uses chatbots to engage the shopper, to get them to sign up for the newsletter by offering a free tactical gear or other option. So they prompt the user with a pop-up, say, hey, enter your email, you'll get this free gift. And then by doing so, it begins an interaction with a chatbot that really allows them to connect on a more meaningful level. Specifically, they initiate conversations via Facebook Messenger. So if you were to look at some of the data that Facebook, for example, has around chatbot technology, you would see that when Facebook first started permitting developers to create chatbots on their platform, it went from about 15% usage in the first month to, in the next 3 months, over, I think they had over 870 something thousand chatbots made by developers to run on their platform. So they saw an overwhelming response to that offer and have actually since had to pare that down so that they could focus their efforts and their strategic strategy. So if your question is, do customers and companies expect this technology as a way to transform engagement? The answer is very clear, and it is a clear yes. 58% of customers say that emerging technologies like chatbots or voice assistants, think Alexa, have changed their expectations of companies. So over half of the people surveyed have said that if these companies I'm interacting with don't provide these types of advanced services, I would prefer to go elsewhere. We need someone who's keeping up with the times. So we at QliqSOFT hear this message loud and clear, obviously, and we know that we've been hearing it actually for more than a year, maybe 2-3 years now, from some of our customers looking for a way to do patient engagement better. Currently, or previously, I should say, we had our secure communication platform, which was how we expect people to add patients and begin communication and have some HIPAA compliant conversations around care coordination and health compliance and things of that nature. But that did require those patients to download an app, which is a struggle for anyone trying to get a patient engagement initiative off the ground. So hearing this feedback from our customers, seeing this wave of technology on the horizon and how all of these industries are readily adopting it, we put a lot of our own R&D into the chatbot space to see, is this a direction we should take our company? Is this a service we should offer our customers? Is this something we need to get into in order to meet our company goal, which is to provide the best tools possible to change and enhance healthcare? And we readily realized that, yes, that is a space that we need to be involved in. So what you're seeing on your screen now is our website. It's a page on our website that you will be hearing more about in the coming months. And it is promoting our chatbot technology, which we call Quincy. For those of you who may be old enough, you'll remember Quincy was a medical provider on a television show not too long ago. But in our realm, Quincy is a chat bot that allows healthcare providers to communicate in a meaningful way and reach their patients where they are. Not having to download an app, not having to go into a portal, still HIPAA compliant, still protecting their PHI, but in a way that reaches them right where they are on their smartphone. Okay, so we can categorize this in a couple of different ways, whether it's patient engagement, care coordination, value-based care, patient satisfaction, chronic care management. All of those things are possible with chatbots and so much more. Now, this is not an advertisement for Quincy, but what I am showing you is our technology today because it's the best thing I can speak to show you the relevance of chatbots in healthcare today. A couple of notes here just so that in the coming slides, I'll actually be showing you a couple of chatbots and allowing you to access them yourselves on your smartphone. So I want to make sure that you understand these 4 core tenets of our chatbot technology. The first being that it is fully customizable. So you can, if you were to become a subscriber to our chatbot technology, you would be able to either take a complete DIY approach, building your chatbot from the ground up, scripting, doing everything, creating your FAQ, deploying it, branding it. Doesn't look like us, it looks like you. All of that is something that you would have access to do. Or if you prefer to work with one of our conversation designers, someone from my team who is an expert in chatbot technology, in natural language processing, in conversational reactions and personality and the psychology behind chatbots, and you could work with one of us as well to build a chatbot that meets your needs. So that's just the aspect of the fact that it is fully customizable. Inside of the chatbot, we have 2 really important components, which I will be pointing out in the future slides here. One is Qliq Forms, and one is embedded FAQ. So Qliq Forms are your opportunity to create a page where you can pull data from your patient. So for example, if you wanted to send your patient an insurance form and say, hey, fill this out before you show up, and that way it saves time, we pull it in automatically. If you have any updates, you can do that in real time, etc. Maybe it's a survey. Whatever the case is, those forms are completely customizable and allow you to obtain that discrete data from your patients. The other embedded FAQ you'll be seeing momentarily, and that is the ability to embed information in the chatbot that allows you to share things like videos, surveys, forms, different calls to action like view our ER wait times, things of that nature. So you can actually embed what we call dynamic FAQ directly into the bot. The last thing here is the easy deployment. So we actually have 3 different ways to deploy chatbot technology. Earlier in this presentation, we were talking about chatbots that are living on websites, right? They're that little button in the bottom corner that says chat with us, launches a conversation. Those are one type of chatbot deployment, and we do support that type. We actually provide you all of the JavaScript that is unique to your bot, and you can embed that on any website, in a portal, anywhere that you'd like to have your patients access a bot. So for example, if you had a surgery scheduler bot and you have an internal website that all of your referring clinics access to pull order forms, order sets, and release forms and surgery prerequisites, any of that information, you could also put your bot there and allow them to do all of that in an automated way. So that ability to embed on a website or in a portal is via the JavaScript. There is also a QR code, which you'll be seeing in just a moment, which allows users to scan the code and then view the bot directly on their mobile phone. That is one of the easiest ways to reach patients. It can also be printed on collateral. You can put it on a pair of socks if you wanted to, but that QR code would launch the chatbot directly on the mobile device and allow patients to begin interacting with it. And it's not just for patients. We actually have customers who are using chatbots now internally to redirect their staff, to provide their home health aides a way to fill out surveys and submit patient paperwork via the bot instead of bringing armloads of paperwork back into the office. So that is not just a patient engagement tool. The last deployment methodology here that you see on the screen is what we call care campaigns, and that allows you to really create a population health initiative around a certain subset of patients. So for example, maybe you deal with patients that are struggling with congestive heart failure, and you've stood up a CHF clinic, and you have patients coming and calling and getting meds adjusted based on their weight fluctuations and things of that nature. You could handle all of that via a bot, and we actually have some customers deploying a CHF bot that allows patients to interact with the bot daily, report their weight fluctuations, get recommendations on medication changes like, hey, I think your Lasix needs to be backed off a little bit, so we're going to adjust your dose. All of that can happen within the bot, and those particular types of bots are best deployed via a care campaign, which allows you to create, say, a CHF patient list with patient phone numbers and then trigger an SMS to all of those patients where they would then be able to click the link and open the chatbot. Now on your screen here, you're seeing 3 different QR codes. You are more than welcome to take your smartphone out and scan any one of these codes to launch the bot itself. I will give you a little heads up. These are demo bots, so they are specifically meant to demonstrate the technology and what is possible. So they are not as robust as what some of our customers are actually creating. And the other thing about them is we also provide agent escalation. So that is the ability at any point, if your patient is engaged with a bot and they get confused, or they don't know how to respond, or they have a question that isn't being presented to them and they want to talk to a live person, they're able to do so by escalating to an agent. Those agents are your staff, your clinical resources, or whoever is appropriate on the back end monitoring a dashboard where they can see those conversations, interact live with those patients, and even transfer it back to the chatbot if necessary. So I bring that up to just tell you, I normally monitor these demo bots myself, but since I'm doing this presentation right now, if you scan one of these and get into an escalation point, you will not get a response at this time. So just know that that is kind of expected behavior because I'm here and not there. So as I was saying, you can actually try to take a picture of any of these to launch the bot. Most phones now are created with QR codes embedded in the camera. It used to be that you had to download a QR code reader app, which was a hindrance to adoption. But as QR codes have become more prevalent in shipping and manufacturing and other forefronts, it has also been adopted better by mobile technology providers. So most cameras nowadays, you just point your camera at that, it'll pop up a little thing asking if you want to go there. You just select it or click yes, and it will transition you to a web page which will allow you to interact with one of these 3 chatbots. So let's talk about them a little bit more specifically. The first one being the ER Concierge chatbot. This demo bot was created in response to one of our Northeast customers who was struggling with some ER wait times and wanted to put more of the chart prep at the beginning rather than once the patient arrived on site. So obviously it's not applicable for every emergent situation, but in the instance that you're going to a quick care or an ER where it is applicable, you would be able to actually access the chatbot, start a conversation, prep your chart by filling in social history, medical history, patient and family history, insurance forms, consents, everything right there in one bot. So on the left-hand side of your screen, you may have scanned the ER Concierge bot QR code, and if you did, fantastic. What you will see is what I've captured on the screen here. On the left is just kind of a snapshot of what that bot looks like. Things are a little cut off here just because I don't have a lot of space to work with, but I want to make sure that you understand what all the components are. So if you were to access the bot, the first thing you're going to see are the FAQs down here at the bottom, and they cover things like, should I call 911? What is a medical emergency? What are the signs of a stroke? And if I were to access that, then it would launch the documents that you see here in the middle. So the top is, what are the signs of a stroke? Obviously, you have rich text that you can build that content out with, but we also allow you to embed videos. So we actually have a Cleveland Clinic video here about the FAST approach for identifying strokes. At the bottom here is another little snapshot of the current ER wait times FAQ. So it just gives a little bit more information about ER wait time and how the chatbot minimizes your time in queue. And then people are able to click on a call to action, like view our current wait times, and see that information in real time. If you decide to actually interact with the bot and start a new conversation, then that is a little snapshot I have here on the right-hand side. You can see that the bot has been talking with the individual and providing different information. And it's actually, the point that I took this snapshot is right before they get into filling in those medical, family, surgical, social history, and consent forms, which really provide a lot of information up front to your registrar staff and even to your clinical staff who may be trying to determine, what beds to use, if a patient should be fast-tracked, etc. The next bot that you have the ability to kind of take a snapshot here and look at is our home health visit prep demo bot. This was created for a specific sector of our customer population that actively goes out into the community and prepares and facilitates home visits with their patients. So one common complaint that they were getting was that the patients were a little dismayed that when home care staff showed up, they spent a good 15-20 minutes doing paperwork, not much clinical one-to-one. They didn't feel like that was a productive use of their time. Obviously, we as the clinicians on the backside, we know that all of that information is not only necessary and pertinent, but definitely makes a difference in the impact of their care. Patients don't necessarily feel that way. They want to talk, they want to have eye contact. So they wanted a way to actually provide their patients a tool to prepare for that visit in advance. So if you were to scan that QR code and interact with this bot, you'd see FAQ like, is this covered by my insurance? There's a health insurance patient form that they can fill out. And then as they have the conversation with the bot, it prepares the expectation for what that visit is going to encompass, how much time they're going to save by prepping in advance, and in the end, provide a survey for the home health agency to actually get feedback. Were our agents there on time? Were they kind and courteous? All those things that affect your patient surveys that you end up getting months later, you can actually address in real time as they come across. Also, it gives that lifeline so that that patient can immediately escalate to an agent if necessary. Maybe they need to cancel their visit at the last second or something of that nature. Then they would be able to escalate to an agent and facilitate that. The last demo bot I'll be showing you today, I could show you hundreds, but I want to respect your time, is a condition management chatbot. So this was created specifically for a bariatric surgery center that wanted to engage their patient population pre and post surgery to encourage them on their healthy lifestyle journey. Obviously, there is some improvement in care post-surgery if you maintain a good diet and good exercise. Your expectation of outcomes is greatly improved. So they wanted to improve those outcomes for their patients, create this bot. We actually were able to turn it into a demo bot, and you can see it for yourself by scanning that QR code. A couple of key features here. They use that dynamic FAQ content to do things like provide a BMI calculator, talk about insurance and different surgeries and options. And they also have a living form inside of the chatbot in the top right corner of your conversation where they will go each day. The patient will log in and not log in, excuse me, that's the benefit of the chatbot. There is no login necessary. They will access the bot, click on that form, log their weight, and be able to track and trend that over time, as well as share those results with the healthcare providers that are monitoring on the other side. So you can see on the far right-hand side here, another benefit to the bot approach is that you can also solicit some commitment from your patients. So you can easily kind of gauge which of your patients are readily available to adopt this type of technology, who want this type of engagement and follow-up, and those that aren't. And then you can target in a very succinct way moving forward. So just again, I'm going to show you these QR codes here in case you wanted to take a snapshot of any of them. Now, as a reminder, these sessions are posted, the recordings, after about 72 hours on QliqSOFT.com/QliqU. So if you don't have your phone in your hands right now, don't worry about it. You'll still be able to access those codes. So we see this chatbot technology really influencing and being applicable to several different sectors of healthcare. The first is obviously hospitals. There's never enough helping hands. We have some fantastic volunteers at my local hospital, and pretty much every hospital I've ever been to. The leadership will tell you they survive on those volunteers that are working that front desk and taking patients around and making sure people know where to go. And they are greatly appreciated resources, but there's just not enough of them. So with chatbot technology, you can do things like discharge follow-up, something like the ER patient Concierge Bot. You can also decongest your call center. You can use a chatbot to actually manage those inbound calls and internal calls as well. Pharmacies and labs are able to use chatbot technology to do things like comprehensive medication reviews, medication compliance programs, and extend medication education outreach. So we all know that with certain conditions, we've got these rules and regulations about how much education needs to be delivered, and you can actually use automated technologies like chatbots to do that. And what's fantastic is you can not only deliver that education, but again, you can escalate to a live clinician if necessary. And one thing I didn't mention earlier about that agent escalation is that when the conversation escalates to an agent, you have the opportunity to initiate a video conference with that patient. Isn't that fantastic? So we know that there is telehealth and all of these things where video conversations are taking place, but now you can actually have those video conversations in the context of a chatbot as well. So if you have an initiative where you have to develop a program where you are delivering face-to-face education with a certain subset of your patient population, and you need to track that face-to-face time and the education, but there's a bunch of prerequisite stuff like getting information from them that takes a lot of resources and manpower. A chatbot can definitely facilitate that process. We actually have a customer. I'm really excited to send out more information in the coming months about what they're doing with a chatbot of ours. I can't say the name yet, but what they have is a HIV at-home testing kit, and it is now being sent with a QR code on the box. The patient scans that QR code, launches a chatbot conversation with them, which walks them through the testing process. And then once they get to the point of a result, they are able to automatically escalate to an agent who then delivers some necessary 20 minutes of face-to-face education with that particular patient. So a really exciting use case that you'll be hearing more about in coming months. Home health and hospice. We've actually heard from several customers, this chatbot thing is not for us. We're home health, we're smaller, we have a niche population. But then once we have actually begun working with some of those customers on what the possibilities could be, the doors fly open. There is plenty of application in this space, whether it be visit verification, chronic condition management, continuity of care, or just providing that lifeline to your patients to reach you in an emergency or at any point. Then all of that can be part of your bot technology and part of your disaster management planning as well. And lastly, private practice. So private practice are probably the slower to adopt this type of technology, but that is typically because they are in themselves smaller entities and therefore maybe don't have as many resources to dedicate to this type of project. But that is why we developed the two different options for developing your chatbot, that DIY approach that might be appropriate for a larger health system that has some IT resources and can do some project planning around this type of initiative. But if you are a private practice or a small business entity and you are still interested in this type of technology, that's where you would probably want to partner with one of the people on my team, our UI conversation designers, to really do it for you from start to finish. Whether that's advanced appointment reminders, augmenting things like your CHF clinic, or even patient transportation services. Maybe you have a subset of your population that is very rural or out of the area or has physical limitations, geographical limitations to getting to their appointments. You can actually allow them to access a chatbot that from there they can interact with you and you can send an Uber to their house. So there's all types of different applications out there for that chatbot technology. Now, surprisingly to me, I have talked through this entire 30 minutes, hopefully not too fast or too slow, but I want you to take away from this session today that chatbot technology is here. It's been here for a while in many industries, and it is really becoming more prevalent in healthcare. It can be secure, it can be not secure. You want to go with a vendor that is trusted in that security space, which is, again, one of the reasons we decided to get into chatbots. We already have this HIPAA compliant architecture for the way that we treat messages, and we know the requirements and what goes into that PHI back and forth with you and your patients. So we are perfectly positioned to kind of help you get into this realm if it's something that you're interested in. So I want you to take that away from it. But even if you decide not to dive into the chatbot pool right now, I want you to start thinking about it right now. It might not be something you have the budget for, the time for, the resources for, what have you, or even just the interest in, but have it in the back of your mind, or else I fear what you will see is in the coming year, 60, 90 days, 3-year timeline, your competitors are going to pass you up in that engagement space. It is a evolution that is, like I said, already here. So if you have an idea for a bot, contact us. My email is going to be on the next page. But I also want to send you this reminder that November's Qliq University is our Qliq 2020 vision. I love that next year is 2020 because we could start talking about 2020 vision in a very comical and cutesy kind of way, which I always love. But it is destined to fill up fast. We're going to be revealing a lot about roles, visit path, care campaigns, and different technology, whether it's GPS location or barcode scanning, and different things that we have on our strategic roadmap, many of which are already ready for you to use. So we're going to talk about that in that next session. So please make sure that you register for it. It will fill up quickly. And lastly, I'm pointing out my email. Usually I have my Jolean.Sheffield@QliqSOFT.com email linked here on your page, but our success team has grown such that we now have success at QliqSOFT.com, and you can expect replies from any one of us on my team, but you can also reach me directly still at Jolean.Sheffield@QliqSOFT.com. So feel free to reach out if you have any interest in chatbot technology, maybe just learning more, maybe it's sharing with me what chatbot you've implemented and what you've learned from it, even if it's with another vendor. We love this space, we love learning more about it, and we always love learning from our customers. So I hope today's session was beneficial to you. Please check and share that recording when it's available on QliqSOFT.com/QliqU, and I'll talk to everybody again in November. Have a great rest of your Friday.